Welcome, everyone. Thank you so much for joining today's workshop titled Incorporating Health and Safety into Home Upgrade Programs, hosted by EPA's Energy Star and Residential Retrofits for Energy Equity at ACEEE. My name is Stephanie Sosa-Coulter, and I am the Deputy Director for R2E2 at the American Council for an Energy Efficient Economy, again, ACEEE. We are so happy to have you here and are looking forward to discussing how addressing health and safety issues increases reach and equitable impacts of home upgrade programs, and also ways to reduce pollution and improve the health of residents through home upgrades. Can we go on to the next slide? Before we get into the content for today's workshop, I'd like to go over some housekeeping to ensure a safe and productive learning environment for all. We are recording this webinar and we'll be making it available to all registrants within a few business days. Please keep your microphone on mute during the presentation, and you will be able to turn on your video. When we have our breakout sessions, you'll be able to unmute yourself. I want to acknowledge that this is a crazy moment in the history of the work that we are doing, and many of you have questions for us. We have experts here that are excited to share their knowledge and experience with health and safety in home energy upgrades and are eager to answer all of your questions on this topic. Therefore, I want to ask that we keep the conversation in the chat and during the Q&A related to this topic. To ask questions during the webinar, please submit it via the chat at the bottom of your screen. Use the chat to engage in respectful and productive discussion with other participants. If you have any resources you'd like to share with participants at any point during the workshop, please feel free to drop links in the chat. We have always found those very helpful. Anyway, this is a good time for you to introduce yourselves in the chat, and that way we can get a feel for who is with us today. We also have a code of conduct. R2E2 will not tolerate behaviors that cause harm or disrupt the learning environment. Please direct message Carolyn Conant if you feel unsafe in this space. Disruptive participants may be removed from the webinar, and I thank you for your understanding. Next slide. So here's a quick introduction to the EPA, ICF, R2E2 staff members who've made this workshop a reality, and the amazing experts, particularly from GHHI, who helped us plan this workshop and also helped us seek out the amazing experts who will be presenting today from various organizations. So we can go on to the next slide. Now I want to turn it to you and get a sense of where you're coming from. And so we have a poll. So please feel free to let us know where you're coming from. And we'll close the poll in about a minute or so once we see things slowing down. So we have a pretty diverse group here. We have a lot from the West, Northeast, Midwest, and we have some from outside of the United States. If you're outside of the United States, please let us know in the chat where you're joining us from. Okay, great. We can go on to the next slide. So here's a map of where people are joining us from. So despite all of us being from different cities and states, health and safety does impact us all. And I'm glad that we can come together to share knowledge, opportunities, case studies, and ideas. Next slide. Now to provide some context on the hosts for the workshop series, Residential retrofits for energy equity, or R2E2, provides deep technical assistance to state, local, and tribal governments, as well as community-based organizations to jumpstart energy upgrades for single-family and multifamily affordable housing, especially in frontline communities. These retrofits will lower utility bills, reduce greenhouse gas emissions, improve residents' health, create good-paying local jobs, and help mitigate racial inequity. R2E2 is a partnership of the American Council for an Energy Efficient Economy, Elevate, Emerald Cities Collaborative, and HRNA advisors. Energy Star is the government-backed symbol for energy efficiency. The blue Energy Star label provides simple, credible, and unbiased information that consumers and businesses rely on to make well-informed decisions. Next slide. If you are interested in learning more about R2E2 and would like to stay informed via updates, please do so by signing up via the link that I will provide in the chat in a few. And also, if you would like to be considered for help from R2E2 to plan, launch, implement, or scale your energy upgrade program for low-income housing, you can fill out a 10-minute survey, and I will again be providing that link in the chat once I'm done with this portion of the presentation. Next slide. Next, we have a graphic that R2E2 uses to talk about all of the benefits that building upgrades can bring to underserved communities. And you'll notice that one of the benefits is, in fact, health and safety, but this graphic also includes increased climate resilience and affordability, a strengthened economy, and promoting racial equity. Next slide. So I will now be passing on the baton to Taylor Jansell from Energy Star, who I've had the privilege of working with during this workshop series, and she will share information about the amazing work that she's doing with Energy Star. Taylor, on to you.
Thank you, Stephanie. I'm Taylor Jansell with the EPA Energy Star products. A little bit about Energy Star. We have been around for over 30 years. We label products, buildings, and new homes, helping people make simple choices about energy efficiency in their lives. We have a new initiative, next slide, that is called the Energy Star Home Upgrade. These are really impactful, major upgrades that everyone can make to their homes to be a part of the clean energy future. These are really significant upgrades that make a huge difference in the comfort and energy use of your home, but they're also really expensive. So we have a really concerted effort to help people minimize the cost of making these upgrades and making sure that we are working with partners all over the country to help get these important upgrades to everyone, accessible to everybody. But the Energy Star Home Upgrade, you can learn more about it on our website. 6 major impacts you can do to your home. It includes getting your home electric ready, heat pump, HVAC, heat pump water heaters, smart temperature controls, attic insulation, and windows. Next slide. As part of this new initiative, we have created a new partnership. It's called the Energy Star Home Upgrade Service Provider Partnership. I noticed some of you are have identified yourself as navigators. That is the type of role that this partnership is created for. It's a new partnership, unlike existing partnerships that we have with retailers and utilities and manufacturers of products. This is a new partnership to really help support the advancement of holistic service providers, helping people navigate the complexity of these major upgrades to their home, energy assessments, financing, choosing prioritization of what to do when, and to make a roadmap. And this is a new partnership that we are looking to grow. And if you're interested, please do not hesitate to reach out to me or go to our website to learn more. Next slide. This partnership is really a national platform. We are doing a lot of our collective communications work and marketing work to promote this journey, this understanding of how to make impactful changes to your home and to be a part of the clean energy future. It's really actionable, and we've done an incredible amount of research to make sure we have messages that resonate with all Americans. And we will be doing more to educate folks on what this means to them and really support folks with understanding how to reduce the cost, take full advantage of all the incentives that are available to them, to make them more accessible and hopefully avoid debt and in making these really significant improvements to their homes. This workshop today is part of an initiative that we are working on with R2E2. We are really focused on collecting and advancing best practices about equitable home upgrades. And we've had an incredible number of workshops so far, which are all recorded and posted on our website. You can go visit. I'll talk more about the schedule, and you can visit our research center at energystar.gov/equitable upgrades. Next slide. And I did want to mention, related to this work, some of you may be interested to know that our environmental justice grantmaker subgrants are available. Some of those are managed by our partners here, Green and Healthy Housing Initiative, Green and Healthy Homes Initiative, sorry. There's a lot of great opportunities to apply for funds to do this work. And I wanted to make sure everyone knew that was available. We're going to pop that in the chat. So if you want to learn more about that. And the next is the full workshop schedule. These are the topics that we've covered so far, and our prioritization for next year is talking about how to maximize incentives for low to no cost home energy upgrades. We are waiting, I'll just say, to see how all the home rebates from the Inflation Reduction Act roll out. And as the greenhouse gas reduction funds are becoming available and realized, we will be sharing those opportunities. Before I pass it back to Stephanie, I just also want to take a moment to acknowledge the significant time in the United States. And I realize that many of you have questions about the future. All I can tell you today is that we have gathered some really amazing experts working to address inequities in health and safety, barriers to home upgrades, and they've generously agreed to answer your questions and stay through the end of the workshop. So I really am grateful to them and all of you today for joining. If you stay to the end, you get to meet one-on-one in small breakout groups with these experts, and it's going to be a fabulous, fabulous workshop. So thank you all for joining us today.
Thank you so much, Taylor. So today's workshop will be separated into 3 parts. The first 2 are presentations with a Q&A, and then the third section will be what Taylor just mentioned, the opportunity for you to chat directly with the experts that we invited today. And I will be showing the agenda throughout the workshop just so that you know where we are. And this is a pretty long workshop. It is 3 hours. And so feel free to hop off, hop on, depending on what your schedule looks like today. Next slide. So the learning goals for today's workshops are to understand the importance of healthy housing, understand how energy upgrades can improve occupants' health, identify barriers to incorporating health in residential retrofits, understanding the concept of a whole house approach to comprehensively provide home energy, health, and safety upgrades, and propose solutions to overcoming barriers and implementing healthy housing services. Next slide. So before we get started, we just want to do another poll to hear from you and get a sense about what you're interested in and which of today's learning goals are of most interest to you. So we'll wait about a minute, and once I see things slowing down, we can end the poll. I'm seeing a pretty good split here. There's a lot of interest in proposing solutions to overcome barriers and implementing healthy housing services, and also understanding the concept of a whole house approach. Great, we can end the poll. Okay, we can go on to the next slide. So now that we've done some level setting, I want to introduce Ruth Ann Norton, who is the president and CEO at Green and Healthy Homes Initiative. Ruth Ann has led its development into one of the nation's most effective and foremost authorities on healthy housing and its impact on the social determinants of health. She directs GHHI's national strategy to integrate climate, healthcare, and healthy housing as a platform for improved health, economic, and social outcomes in historically disinvested communities. We are so grateful to have you, Ruth Ann. You're on mute.
There you go. The host had to let me unmute. So thank you very much, host. And thank you, everybody. And I amazingly love our partnership with R2E2, ACEEE, the Department of Energy. And I just want to say thank you. I think, and if I may take one moment to say to everybody who's here today, there's a lot of craziness that's going on in the world as we go past elections and move forward to other things. But the one thing to know is that regardless of administrations, healthy housing has remained a very bipartisan, well-supported set of work. And so it gives us a glimmer of hope for the future. But it's also so grounded at the local level where locals leaders are the leadership of today and tomorrow. And so I'm really happy to be here to talk about that. Our organization, the Green and Healthy Homes Initiative, is very proudly headquartered in Baltimore City, from which we have grown, and where we originally started our work focused on the eradication of the toxic legacy of lead. And as we learned more about housing, about health, and about the benefits for the families that we serve here and across America, it has been a great journey that we continue to unfold. Our mission is to address the social determinants of health, the drivers of opportunity, and the advancement of racial and health equity through the creation of healthy housing, all honoring the original 9 parents whose children were poisoned by lead in 1986 that led to our scope, our mission, and our drive to ensure that we raise the moral compass of housing, that we ensure that in that, in our work, we're grounded through good indoor air quality, through eliminating extreme heat and cold, and ensuring that we are following clean energy and Energy Star practices. So let's go to the next slide, please. What keeps us up every day and every night in our work? When we go home, all of us worry about this one thing, which is there are 34 million families that today still live in unhealthy housing conditions, and not just small unhealthy housing conditions, significantly impacting their health, for lead, for asthma, for trips, preventable trips and falls, and all of it in many ways tied to the energy efficiency, clean energy, and carbon emissions in their home. 40% of all hospital admissions and emergency room admissions in the United States are attributable to the unhealthy housing conditions in America, according to the Robert Wood Johnson Commission on Building a Healthier America. But what we know out of all of this is that energy is a fundamental linchpin to all sorts of things. When houses expand and contract, paint is going to chip more. There'll be more mold, mildew, and moisture. Roofing, from roofing to foundations, we're looking at all of this. And as we go along, understanding that the intersection of health and safety with efforts around weatherization, energy, and clean energy are critical, because it's health and safety that unlocks the ability to do the rest. If we can go to the next slide, please. So the way that we look at our work is to take an aligned whole house approach, as we now call it. So GHHI is kind of the OG of the whole house movement from back in the day. But this is to align, braid, and coordinate resources that are looking to make sure that we're maximizing every dollar, cutting out duplication of services, but most of all, delivering an integrated practice for families so that they are not searching through the 200, 300, 400 federal grant opportunities that actually are focused on improving the condition of housing in America, whether it's moderate rehab on LIHEAP, or it's the maternal child health block grants, or the more normal things that we think about, WAP, GGRF, lead hazard control. These are all things that families really, we're trying to move them away from having to figure out where to go for those grants, and to focus more on condition of residents and condition of houses as an aligned practice in the home, and spend much more time on the outcomes. So if we want to go to the next slide on this. So our whole house strategy, as I should say, also was shown by Cornell University to improve wages for contractors, to give better opportunity to community-based contractors who, when multi-skilled across this framework, will start at a 4 to 8 and higher level, $1,000 level than their peers, which becomes significant in and of itself. And that is actually improved more likely to have consistent jobs, more likely to have higher paying jobs with benefits. So we're looking at the family level, the contractor level. We're looking at equity, where dollars go, and what does it translate to as we address all of those matters that impact health significantly in housing, whether it's lead paint, which not only and the chipping, peeling, flaking dust that comes from that, or soil or water. That doesn't affect just children or just pregnant women, but primarily there, but also adults. An adult who has exposure to lead has a 46% increase in early mortality, a 16 to 19% increase in cardiac arrest. In fact, the 2019 Journal of American Medicine, a JAMA article that recently came out of 2019 on 2019 data, showed that 5.5 million people could be directly attributed their deaths from cardiac arrest to lead. Asthma, we all know the epidemic that causes in our classrooms and in missed work, injury, hazards for our vulnerable families, but really important as we build age-in-place frameworks for our grandparents, our older adults, and then the rest of the important work, general housing rehabilitation. We have to fix the roofs in order to make sure solar can go on. We have to ensure there's no leaks so we can electrify. Electrification not only increases protections against fire safety, but it ensures the resiliency of housing for the future, decarbonization, and our goal as we strive to a zero emission heating and appliance standard in Maryland and across the country is so much grounded in health data, not only on respiratory health, where the gas stoves exacerbate asthma by a plus 42% increase, asthma incidences by another 24%, but benzene and nitric oxide and its impact on cardiac, neurological, reproductive health. So we care about all of this, and by doing this as a whole scope, we are able to do it more efficiently, more effectively, at a lower cost and pay more in wages. So let's go to the next slide. So we know we've seen some things through our studies that we produced for HUD, and we're seeing this in our own data and as we approach a whole house program here in Baltimore that includes electrification, includes solar. We know that we have a documented 66% reduction in asthma-related hospitalizations. We've also done about 32 to 40 feasibility studies on this work, looking at 800,000 patient records across the country. And we know that that is a baseline number in other jurisdictions where we've looked at this, and it's been looked at in Philadelphia. Those numbers are 76%. And we've seen this across the country, high rates of lowering hospitalization and emergency room visits. But let's talk about what matters. An increase in school attendance, getting kids in the classroom healthy, ready to learn. This is common sense. We all know this, right? If a child lays their head down at night in a place in air they can breathe, that is stable, that is has thermal comfort, that is not full of mold, mildew, and moisture, they are going to be better kids the next day and better able to learn, earn, play, all of those things over time. Parents' ability to get to work has a really significant increase here and improvements, not staying home, not only because of emergency room visits for their kids who are sick, but themselves or kids who don't sleep through the night because they can't breathe. Really significant pieces here. We know of about $2,000 in Medicaid savings a year. We see more than 404 on an average annual energy cost. State of Maryland now predicts that the work that we've done on low income households for our Empower funds and for the work that we're doing in cleaner energy is going to result in about a $2,800 a year savings in energy savings. And when you're coupling in solar and other pieces to this, we start to talk about improved housing stability, improved market values for homeowners, and closing things like appraisal gaps and addressing those racial disparities, not only in health, but in economics. We'll go forward, please. So we utilize a lot of innovative funding to create sustainable services for SDOH. We do it in lots of different ways. We worked with CMS and many partners to unlock dollars through the Children's Health Insurance Program, where there's some upwards of close to $1 billion a year of unused administrative dollars that can be redirected to lead and asthma mitigation in housing. We are now advocating to move that and increase the definition around that, the decarbonization and electrification, its impact on respiratory health should absolutely be covered in those CHIP services. We think it fits the asthma outcomes model there. The first place that we saw this really start to be put to use was after the Flint water crisis. And then we have seen this unfold, and not only here in Maryland, but in many states. Healthcare investments and partnerships that we've established with places like WellPoint, used to be AmeriGroup, where we've shown a 32% per patient reduction in cost by improving outcomes on asthma, where every dollar that they are investing in our work, they're getting $1.58 back. Blue Cross Blue Shield of North Carolina, where we worked to help bring a collection of community organizations together to implement preventions on fall preventions and trip and fall injuries for people coming out of surgery, those who are disabled or have chronic issues, not only just the elderly, but a larger population. Hospital investments, we have the largest healthcare investment in de-leading and making healthy housing in Lancaster, Pennsylvania through Lancaster General Hospital. We're going to do at least 2,800 homes, or on pace to maybe do more. We've added healthy housing money. We're going to be adding money around energy and also the establishment of funds. There's now a potential of HUD advancing this work on building funds like the fund in Chicago, the fund in Michigan. So somebody asked a question I saw it pop up too in all of this work. As we look at this, we are doing legal services work, we're doing case management work, we're doing education. And our work in Baltimore, in Providence, in Lancaster, in Memphis, and around the country, but in places where you have direct services, we're serving rental properties and homeowner properties, whether they're single or multi-family. And our portfolio is rather balanced there. And we have seen a lot of movement to move property owners into large compliance. Even property owners who have fought us on legislation will end up coming into compliance because the business case is so important and so impactful for them as well as for our healthcare system. So I'm happy to talk more offline. We've done a lot of policy framework around registration of properties, around using rent court to not only abate rent, but to drive cleanup. And in Maryland, for example, we put in measures in the law that said if you're not complying on things like lead or the related health and safety measures, you can't use the courts to collect rent because it's effectively an illegal rental in the state of Maryland. So there are ways to move this and move it from the local level up, and then get reinvestment from reimagined utility programs, increasing investments, healthcare and managed care and health endowments. So if you want to move to the next slide. So in our model of integrating energy, health, housing, and equity, which is measurable equity, right? Climate is such an important pathway. It's why we are standing strongly in every market. And now, as we move into a next administration, talking about the benefits of moving to a zero emission heating standard and a zero emission appliance standard. Our work is grounded in health because residents, all of us, right, is what we can feel, it's what we experience, it is what impacts our life most. And building in health means we're going to build healthier environments. Don't forget, it was Florence Nightingale who was the inspiration for housing codes and sanitation codes. So it started with nursing, it built out to health and housing. So we're really shifting from disinvestment around really bad policies. Unfortunately, we are the home, literally, Baltimore, of redlining, and really undoing policies and practices and moving them to the opportunity, to the value proposition of healthier housing, reusing housing, building resiliency in housing, reducing deferral rates and weatherization and energy programs and electrification programs by ensuring underlying health and safety is taken care of. You cannot electrify a wet house. You can't put solar, as I said earlier, on a leaky, unstable roof. These things are necessary to unlock how we can leverage health, housing, and energy together, and ways that we can ensure that contractors are not just getting better paying jobs because of it, but we're also investing in a workforce program here in Baltimore to do apprenticeships around this work and to build toward ownership of this work by communities. So we are, this is our standard 8 elements of a healthy house, but please stay tuned because starting later next week, we are announcing the new 10 elements of healthy housing led by our work in decarbonization and electrification, because there has been a significant advancement in the health data around that and the data around making healthy housing being housing that is more valuable, more stable, and certainly more equitable. But these elements from dry and safe and pest-free and well-maintained, well-ventilated, contaminant and toxic-free, clean, and energy efficient all come from our work originally with the Healthy Homes Rating System, which came out of England, to the HUD's 7 principles of healthy housing, but all of it integral to the work that residents feel that they can adopt and that become a way of maintaining houses on a post-remediation basis as well. Go to the next slide here. So really common sense stuff here, but we'll go through this, right? Dry homes, we're avoiding mold growth, right? We're going to reduce that, the whole series of emergency room visits for young kids with asthma and reactive airways disease, as well as adults. Children admitted to the emergency room for asthma exacerbated by their homes are likely to see the emergency room 3 times a year. If they're hospitalized, they're going to be hospitalized likely twice a year. That mounts up in opportunity cost, in trauma, in fear for that child, in poor health, but it's also costly for out-of-pocket medical costs and costly to Medicaid for those families that are experiencing that. And so by improving indoor air quality and keeping it dry, we start to have a pathway to health. And plus, people have more pride in this. We're going to keep moving here. The same that goes for ventilation, making sure we're meeting all of the rate standards to remove VOCs and the like. We care a lot about, what kids have access to about safety, about trip and falls, about what chemicals are in the home. So really giving strong education around what we do, around accidents, around windows that go up and down properly and don't slam. We look at every aspect in our comprehensive assessment, but it pays off so significantly. Even kids who have radiator burns, second and third degree radiator burns, can be devastating and undermining for children for a lifetime. Can we go to the next slide? So these are slides we will share with you around these elements of how we're protecting, moving to induction stoves so kids can't burn their hands, fixing stair treads, electrical wiring, and cleaning up everything from lead pipes to airflow systems to the soil around houses. When we take the time to make this investment, it pays off for decades to come. Next slide, please. So same thing on fixing the foundations, not only for moisture and leakage, but we're looking at contaminants from pest management, from chipping paint, from things that are coming, asbestos, radon, sealing, all of these things, indoor air quality. So getting those contaminants out. A lot of education with resident behaviors, all of our behaviors. I know I'm supposed to drink 8 glasses of water a day. It's really tough to make sure I do it, but we help people through reiterative education and helping them kind of captain the plan on this as well. We will share the recording. Can we go? I'm just seeing the chat, so sorry. I think we can move past this so that we can really talk about getting to the Q&A as we talk about how we maintain these houses for the future. And I see here things like gutters. A $10 repair can certainly avoid thousands of dollars and health issues on mold, mildew, and moisture. Taking a radon test, doing $1,500 of radon mitigation for one of our families in Utah. The failure for that $1,500 to be expended cost her $1.5 million in medical costs in response to the cancer that she incurred. So radon's a very important thing for many of our locations around the country to do. Much, much cheaper on the front end than on the back end. So let's keep moving here. And of course, making it energy efficient. What we're trying to do in our Buildings Up program as we move to not only weatherization, but as we go to solar, as we go to decarbonization and electrification. But what got us into this whole aligned process was that in the early 2000s, we started to recognize that we were investing millions in lead and healthy housing, and well over 30% or more of our population clients were moving because of the energy costs. That's what got us into this. What the journey has proven is how much it means in terms of health, housing stability, value, and something again motivated because people can feel it. And we were able to drive down deferral rates and declinations by doing this. Weatherization, one of the most important housing programs and one of the largest rehab programs in the country, is so critical to health and opportunity for families. So if we can go to the next slide. All right, we're at Q&A. I don't know if I made the time frame. I'm 1 minute off. Sorry about that.
No worries. Thank you so much, Ruth Ann.
Fast, right?
Thank you so much.
Nerds at GHHI, or at least I am. I can't speak for everybody else. So we could have talked forever about that.
So we do have a question that we saw in the chat. Can you speak to the strategies you use to engage landlords who might not want or are hesitant to have weatherization in their rental homes?
Sure. You know, a couple of things are really important, right? When you sit down with landlords and talk to them about the cost of turnover, it's really expensive for them to have that whole move people in, move people out, repair the units. It becomes more expensive in a state like Maryland, where not doing weatherization leads to other problems like lead paint in older housing, chipping, peeling, flaking, paint, requirements to clean up things like windows and others. So it really couples into that. But when we also look at for landlords who pay the utility bills, there's a big incentive. And landlords who pass on the utility bills, there's a big business incentive for really making that investment. And often these investments are being paid for by the government, right? So capturing the value of upgraded systems and being able to put that into property values is another case there, and not being dragged into housing court for issues of mold, mildew, moisture, chipping paint, or others. Now, I think the question is who reaches out to landlords? And you may help me on that, but when we, and I'll use our Baltimore program or any of our other programs, when we go into a home to do material work on rehabs, retrofits and upgrades, we do a mutual service agreement. So we have to reach out to the landlord because we're going to make significant moderate to significant changes. And so we sit down between we have liaisons who work with landlords who go through that, educate landlords on the case. And I think weatherization done well should improve indoor air quality, but we certainly are looking at indoor air quality. I see the chat there. I'll leave that to experts on that. But staying out of rent court, improving housing value, having more stable tenancy, and really when you talk to people, the health of their residents does come into play, and being able to be that good guy, good woman in that work. We're pretty persuasive with landlords, have been for a long time, maybe because we've also had legal services on the other side ready if they don't participate, but not always. I mean, mostly it is the business case and the moral case that they actually do join in with us.
Thank you. I think we have time for one or two more questions. So one is, where do we expect to see the leadership on healthy housing coming from in the next few years? States, local government, nonprofits, philanthropy?
Well, I hope certainly from us, we are committed to being partners, colleagues, and leaders in this. We're not deterred by the times we're in. We're actually energized to focus. But I said this morning in an interview that this is the time for local leaders to lead in this nation, that we figure out policies and practices that stand on their own and that we build forward with common sense investments that I think that there will be a large case to continue from the federal government. Lots of very distressed communities around this country are benefiting from things like weatherization and other investments in healthy housing. We are going to be doing a lot of convening around this intersection of climate, health, and resiliency. ACEEE, I know, is doing some. We're going to be doing a lot with partners like Elevate and others around the country. But we're working already to talk to governors, to talk to mayors, and really be able to have a more conducive way of doing business in a more integrated fashion to maximize federal dollars. And one of the big cases here is that if we do our work well, right, we are lowering healthcare costs, we're improving school attendance, we're improving work attendance, we're improving housing values, closing appraisal gaps. There are economic benefits to the nation writ large for this work. For every dollar we invest in lead prevention alone is a $221 return. Every dollar invested that lowers the rate of asthma is $14 and probably higher. Those dollars haven't been adjusted to current times. And we know the benefits for climate. Under a framework of healthy and resilient housing, we're able to make that case. And I think healthcare has come in as a major partner here. So I feel that we may have to refine our arguments, but there are many leaders, and we're going to be reinstituting our Executive Leadership Institute, but many leaders in this space.
Thank you. So that's all the time that we have for questions. We're going to take a quick 5-minute break before we go into the second portion of the presentation. So I just wanted to show you the agenda again. We are moving into the second portion of the workshop where you'll have the opportunity to hear about how integrating health and safety into energy home upgrades helps serve low-income and disadvantaged communities without deferrals, and then a presentation on innovations and opportunities unlocked by integrating health, safety, and energy upgrades. Next slide. Before we get into the panel discussion, I have another poll for the audience. What percentage of homes in your state do you think are deferred from weatherization, energy upgrades due to health and safety barriers? So I'm seeing a lot between 20 and 30%. And then a lot over 30%. Great. Thank you. We can end the poll. Next slide. Next slide. So here are our 4 amazing panelists who will be discussing how integrating health and safety into home energy upgrades help serve low-income and disadvantaged communities without deferrals. I will introduce each of them in more detail before their presentations. So first we have Bert Cooper, who is the VP State and Local Strategic Services, VP of State and Local Strategic Services at GHHI. Bert supports GHHI staff around the country as they work with local partners to deliver technical assistance, implement national and local initiatives, and develop new collaborations to advance GHHI's mission. Bert, I will pass it on to you.
Great. Thank you very much, Stephanie. I appreciate it. Yeah, I'm looking forward to sharing a little bit about the work that we're currently doing in Trenton, New Jersey, and may mention a couple other spots as I move through the presentation here. But I first wanted to just give a sort of a little bit of an overview and maybe a tiny bit of review from what Ruth Ann said. But we see and believe that the health and safety related deferrals reflect housing inequities and drive an energy efficiency gap, particularly in the communities where we tend to work. With 34 million houses, as Ruth Ann noted, have serious health and safety hazards. Poor quality, disproportionate the housing impacts low-income communities due to patterns of underinvestment, historical redlining, and where those communities also experience greater exposure to pollution. The communities where we work, and it was interesting to see the previous slide, experience pretty significant deferral rates. I know we're seeing between 30 and 40% on an initiative we're working on here in Providence. Similar numbers in Trenton, where interestingly both those locations experience somewhere in the neighborhood of around it would appear 115 deferrals a year as part of these pilots that we're working on. And so we're looking forward to continuing our partnerships to address the issues that are driving those deferrals and get them back into the weatherization programs in those respective communities. So reasons for deferral, this is likely not going to be news to many of you, but these include issues we most regularly see: roof damage, usually related moisture damage, or other critical structural hazards, some of which can get quite expensive to address or remediate. Presence of asbestos, mold and moisture, lead dust, other issues that may prevent contractors from being able to run lead blower door tests and whatnot. And so pretty common, but I think sort of predictable set of issues that we come across. You can go ahead and go to the next slide, please. We do think of this at GHHI, and Ruth Ann shared our message, as a basic sort of equity issue. If you're not able to access these programs, you're not going to be able to weatherize your home, or thinking about other health and safety programs, even get the lead issues addressed to make it a safer home. But the way we think about this, and I won't work through this slide, is basically addressing these health and safety issues really unlocks the opportunities for low and moderate income homeowners to access a whole bevy of resources, including weatherization, and increasingly with the IRA resources coming down, incentives, depending on how states have structured their programs, in particular through the Inflation Reduction Act and other benefits. And so, if you're going to be working in these in low income communities, and those are the folks you want to serve, you have to figure out how to adopt what we would call a whole house approach and address these health and safety issues to get these homes into the system. And so we'll go ahead and talk about an example of what we're doing in Trenton, New Jersey, and I'll try to make that very tangible for you all. These homes that you see in the images here are actual homes that we've been working in as part of our Trenton Whole House pilot, which is a partnership with a number of organizations there. I'll just sort of explain who we've got at the table. New Jersey Comfort Partners is actually a program. It's the ratepayer funded weatherization program in New Jersey that is administered in collaboration with PSE&G, which is the local utility, and the regulatory body there that oversees the program is the Bureau of Public Utilities at BPU. So we've been contracted with BPU to work with the Comfort Partners program and CMC Energy Services there, along with PSE&G, to basically conduct this pilot in 100 units that have been deferred from the Comfort Partners program, to essentially get the issues resolved and get them back into the program. We also work with the Department of Community Affairs there. We have a lead program that we're standing up that we are looking to integrate and are integrating into our whole house pilot there to address lead hazards in folks' homes as well. So we're looking to make it a comprehensive intervention. You can go to the next slide, please. So I mentioned the challenges in addressing equity. I won't dwell on this again, but making sure that we're leveraging whatever resources we can to address these health and safety issues and deferrals is, as I mentioned, necessary to create equitable access to weatherization, energy efficiency, electrification, and decarbonization opportunities. I'll talk a little bit more about the pilot here in a moment, but we were sort of working on two ends of this. We received the deferrals from the Comfort Partners program. We go in, we address the health and safety issues, refer back into the weatherization program. They go ahead, will run blower door tests and conduct their weatherization and install their weatherization measures. And we're very excited about this now as part of the those 100 units. We're setting up a pilot to go into 20 of them to basically assess for additional electrification and electrification readiness measures, and we'll be installing those as well, which we're just at the front end of that process, and we'll be happy to share more as we complete that and share the learning from this pilot as we move through it. But you can move to the next slide, please. So we just wanted to make a quick note here around Trenton. We are conducting the pilot in the city of Trenton, the state capital of New Jersey. If folks are interested, I'll drop this into the chat when I'm done speaking here. We conducted an asset and gap analysis in New Jersey to sort of figure out where we wanted to focus this work, looking at a number of different measures there, which are in the first table on the left. In Trenton was sort of an obvious choice for us. And as we started the work and started working with families, just we wanted to share the common causes of deferrals in the homes that are in the pilot presently. So mold is a big one, not unexpected. Leaking roofs, as I noted earlier, asbestos is another common one. Those are the much the biggest ones, and we'll occasionally see foundation leaks. We were thinking that knob and tube wiring would be a bigger issue for us. It's turned out not to be, but just wanted to give you some examples of the issues that we're encountering there. You can go on to the next slide, please. So goals for the pilot in the work that we're doing there. The reason we're doing this work is we're basically looking to figure out how to streamline and integrate programs to provide services. And we're working in 1 to 4 unit residences occupied by low and moderate income folks to improve energy savings and health and safety outcomes. So we are working with the Comfort Partners program to basically help them figure out, as part of this pilot, how to systemically incorporate health and safety measures into their program, along with the electrification measures I mentioned on the backside, to help them meet a statewide goal that the state has set to make 10% of their low and moderate income housing stock electrification ready by 2030. So while we're only working in 100 units, this is an important effort for us as we really dig in and look at these 100 units and figure out what sort of changes BPU and the Comfort Partners program can incorporate to advance health and safety and electrification in the state as they work to meet that 10% goal. I mentioned we're going to complete whole housing interventions in 100 units with electrification in a subset of 20. We're evaluating this work 9 ways to Sunday with BPU. Have a whole host of measures that we're looking at, and can talk about that a little bit more in the breakout rooms if folks are interested in it. And then I just wanted to note the resources that we're braiding there include the DOE state energy plan money. It's been provided through BPU, that we're using that primarily to address health and safety issues that open up the door to weatherization. And we'll be using it for electrification measures on the back end as we look to leverage and incorporate incentives and other IRA resources. We are also working with DCA, I noted, around lead paint remediation, and Comfort Partners provides the weatherization and energy efficiency measures. You can go to the next slide. So this is what this looks like, just to break it down a little bit. When a client is deferred from Comfort Partners, they're referred to our office there in Trenton by the Comfort Partners initiative. So it's a pretty direct relationship. They send them over to us. We reach out to them and see if they would like us to address the issues in their home. Assuming they say yes, we go ahead and we do the intake work with them, bring them into the program, and we will assess the the client to understand sort of their needs and understandings of the issues we're working on and addressing in the home. And we also collect quite a bit of baseline data around comfort score assessment, sort of health and safety related knowledge, sort of understanding the issues in their home. And this is all done by our bilingual staff there in Trenton. We then will go ahead and begin, as part of that process, a home visit during which we will start educating about the issues in their home and assessing. This is an important part, making an assessment of what the home needs to actually both address the reasons for the deferral in the unit and to address any other health and safety issues that we might find in the unit that need to be where there needs to be an improvement. We maintain a pool of contractors, so we will take that assessment and develop a scope of work. We'll send it out to bid, and we'll work with a growing number of contractors to go ahead and get the intervention done. At which point we go back through, make sure the work was done well and to a high quality, and then we'll go ahead and close it out and send it back to the Comfort Partners program so they can conduct their weatherization assessment. And now that we've addressed the hazards that typically will have prevented that, and they'll put together their weatherization scope. I will add, and you can now we're literally in the middle of this. We're working on how to model the weatherization and potential electrification measures that will be installed in these homes with CMC Energy, and we'll be working with CMC to basically install those measures as they do the weatherization work moving forward. So that's essentially what our program flow looks like, and just wanted to share that so folks understand what exactly it is we're up to. You can go on to the next slide, please. And so what's next? As I mentioned, we are in the middle of developing the protocol to model our electrification measures, so we can share with families what the impact will be on their energy bills, particularly as we look at fuel switching in particular, as we're interested in taking some of these units completely off of capping their gas lines. And so we need the data to be able to talk about that and explain why that would be valuable for them. So we're going to be doing that in at least 20 units. We're sending units back to Comfort Partners. I'm excited to say we were just awarded a grant from the New Jersey Department of Health to start layering in asthma education services over this particular initiative. And so if you think about what we're doing with the electrification and the health and safety, getting mold out of the homes, it's actually a perfect home-based asthma intervention, as well as we're removing those triggers from the home. So we're going to be doing asthma education with families where there is an asthmatic in the home, and referring young families with kids with asthma into the pilot as well. So we're super excited about that. So we'll continue building out those types of partnerships, and we will complete our evaluation and look forward to sharing that with our partners at BPU and CMC as we hopefully incorporate lessons learned and continue to grow the program. So that is where we're at, and I'll be happy to talk more about all of this in the breakout rooms afterwards. Thanks, Stephanie.
Thank you so much, Bert. We can go on to the next slide. So now I want to introduce Emily Olivo, who is the lead environmental sustainability specialist for the city of Fort Collins in Colorado. And in this role, she serves as project manager for Healthy Homes and indoor air quality focused environmental justice program, as well as the Climate Equity Committee, a group of area residents ensuring equity in the city's climate plan. And also Heidi O'Mara, who is the Environmental Justice Program Coordinator for the City of Fort Collins Healthy Homes Program, which focuses on working with the community to create healthy, efficient, and resilient home environments. So I'll pass it on to you.
Thanks so much. And thanks so much for having us. I'm excited to talk about our program. I'm just going to start by giving a brief overview of our program and how it's changed over the years. And then Emily will go into more detail on the work that we do as part of the City of Fort Collins Healthy Homes program, which is based on HUD's 8 Keep It principles of a healthy home. So our program does in-home indoor air quality assessments, which focus primarily on education of those principles. as well as behavior change through low to no cost solutions to improving indoor air quality. It's also a volunteer-based program, meaning that those assessments are done by our trained healthy home educators, which is a really important aspect for building trust within our community. The program has been around for about 13 years and has seen many evolutions, and I'll talk a bit more about that on the next slide. So as you can see here, our mission and vision for this program. And our goal, as I mentioned, goals of the program, as I mentioned, have evolved or expanded beyond indoor air quality and now has a greater environmental justice focus. So the program now includes home comfort or resilient to provide resources and education to our community members so they can stay safe and comfortable in their homes during extreme temperatures and wildfire smoke or poor outdoor air quality events in our community. This expansion of the program also utilized a variety of engagement strategies, and community-led planning and implementation, which again has been important for building trust. As a government, we know that that's a big barrier that we have and really want to make sure that we are including community and making sure that we're providing a program that our community wants and that meets the needs that see are most important to them. And we were able to accomplish all of this expansion and some environmental justice funding. And I'll talk a little bit more about that or outline that on the next slide. So in 2021, we received a 2-year grant from the EPA, and again, to focus on environmental justice. And that's where we were really able to expand and incorporate that 8th principle. And now there's going to be 10, which is exciting. I'm curious to see what y'all have come out with there. And so during these 2 years, we really updated the program, got a lot of community feedback through this EPA environmental justice grant, and had a really big focus on language justice to make sure that all of our materials and assessments were done in the language of our community members' hearts. And then this year we received a grant through our state health department, again, to continue focusing on environmental justice and really expand our offerings and services and resources that we get to provide through this program. And then the city of Fort Collins also voted in a sales tax to help with parks and recreation, transit, and climate initiatives. And we got a good amount of funding through that as well to continue this work within our community. And now I'll hand it over to Emily to talk a bit more about the work that we get to do.
All right. And so, as Heidi mentioned, we have an environmental justice focus for our program. And so our program is open to all residents of Fort Collins. Anyone can participate, but where we focus and really promote our program and who we kind of market to are populations that are disproportionately affected by climate change and poor air quality. So that's people with respiratory issues, moderate to low income households, older adults, a lot of the populations that you've heard about a lot in this in the presentations so far today. We do work, most of our assessments, I would say, are in mobile home parks, and roughly half of our assessments last year were in Spanish-speaking households. And so and a lot of that is due to some of the language justice focus and having bilingual volunteers and bilingual everything in both Spanish and English, as Heidi mentioned previously. All right, so next slide, please. And so what it looks like is that everyone who participates in our program receives an indoor air quality assessment where we walk around the home and we provide low to no cost, many often behavior-based recommendadations. So simple things like take your shoes off when you come inside, or switch out some more toxic cleaners for vinegar or other cleaners when you're able to. And everyone receives this assessment and while they're at that assessment, we also provide resources like a short-term radon test kit, reusable grocery bag, because you can never have too many of those, a natural cleaner with a recipe so people can make more, reusable cloth, doormats, if we see that there's a need for smoke and fire alarms and fire extinguishers. We've also been able to provide portable air cleaners, as well as provide information on how people can create a safe airspace. Because I know this is the case for many people on this call. Wildfire smoke is pretty much, unfortunately, how our summers are now. And so we really try to educate people on how to create a safe airspace in their home using that portable air cleaner. After our assessment is done, we then work with a local HVAC and plumbing company who goes out and does a inspection and a cleaning of folks' furnaces. And through that, we've been able to repair or replace a number of furnaces that were that were becoming a pretty big health and safety issue. We've found in a few homes where somebody was actually, their furnace was leaking carbon monoxide, and we were able to replace that. So we've been able to get into some and mitigate some pretty scary situations, and that always feels good to be able to be that resource for folks. And then the other part that I wanted to focus in a little bit more on today is the weatherization services that we provide, as well as what we just call special projects right now. So essentially, we have a weatherization contractor that I'll tell you a little bit more about on the next slide. But they go to folks' homes and they do an assessment. They do some basic air sealing with caulking and weather stripping, and they let us know what kinds of what additional resources a home needs in order to be a more climate change resilient home. And so, I'll get into more detail on that in the next slide. But one other last piece I just want to share on this slide is that we also connect people to other programs. And so that includes things like the Colorado Affordable Residential Energy Program, CARE, LEAP, I think was mentioned already today, the Low Income Energy Assistance Program. We work with our local fire authority to connect people to additional fire safety resources if needed, as well as a number of other programs. And that includes other programs within our city where folks can get connected to resources. And so, so one of the pieces that I think is really relevant to today's conversation is that those deferrals that were mentioned. So programs like CARE mentioned here are wonderful. They do amazing things, but sometimes there may be barriers for folks. So maybe the application itself is a barrier, or the income requirements are a barrier. We may also find that CARE doesn't have funding that lasts the entire year or can't fund everything. And then there's also things like it was mentioned here, where maybe there's a roof leak or a mold issue or a plumbing fix that needs to happen before a home can actually be eligible for CARE. And that's the gap that we've been really trying to focus in on as a program, is how can we really be the people who make a home more eligible for all these additional resources, right? Or if a home isn't eligible, or there's something that needs to happen much faster than maybe it could happen with another program, we're trying to be that program that steps in. And due to the amazing privilege that we have of having good funding right now, that we're able to be those gap fillers. So, okay, next slide. So what that weatherization looks like is, and I'm not asking anybody to read this in detail, but we just wanted to provide a quick look at what the assessment looks like that our weatherization folks go in and do. So Eris is an amazing local company that has really the same intentions that we do for helping homes in our area be safer, be healthier for our community. And so they go around and they will do a blower door test, and they look at everything that you can see here. And then if you can click it one more time, there's one more page that pops up. Thank you. And so this is where the report that we get, and it says, okay, there's insulation needed here, or there is there's no storm windows on a home, or maybe we hear that somebody has a gas stove in there, and maybe it'd be the home would be a really good good home to upgrade to an electric range. Or one of the most common ones we see is that the hood vent above the oven needs to be vented outside. That's a really common one. And so essentially they provide this this list of recommendations to us, and we then discuss as a team what we can green light and what we can't. And so we do have some some parameters around that where we really try to prioritize health and safety first and foremost. We make sure that before we do additional special projects, these are the special projects I was talking about, that before we move forward with those, that we want to make sure that the participant is in one of our focus populations that we mentioned at the beginning of this. And then we also we do have some monetary parameters around this, with a max amount that we can spend per household, that we did build in some flexibility to that, knowing that some homes have more need than others. So really trying to look at this from an equity perspective, right? Being able to be flexible with our policies and processes so that we can meet homes individual unique needs, rather than just saying every home gets $5,000 or whatever it is of upgrades, right? We really are trying to approach this with an equity perspective, and know that the need is greater in certain places more than others. So I think that's all for this side. If you can click the next slide. Here are some more specific examples of some projects that we are currently funding. And so I already went through a lot of this, but something that we will find that we have seen a lot of is, bathroom fans that just don't work or don't even exist, especially in mobile homes. There's a lot of older mobile homes that we go into that don't have any bathroom fans. And then that builds up to a moisture issue, mold issue, and then drywall issues, right? It just kind of cascades from there. So that's an example of one that we've been really trying to address in a lot of homes. And yeah, next slide.
Emily, you have about 1 minute left.
Okay, great. It's our last slide. So we just wanted to share with you all some of our lessons learned so far from really piloting and experimenting in this space, which we've been so fortunate to be able to do thanks to our grant dollars. And so one of the most important ones that Heidi mentioned is that ensuring that you take the time for language justice, that you have proper representation in what you do, and you take that time for trust building. It works. We've seen it work. So it's worth it. Do it. We've also learned very much the hard way that every home and situation is unique. You have to be prepared to adapt and try something new. Every single home, it's its own unique situation. And so you can't have just like a one size fits all recipe. And in the beginning of things, we tried to do it all ourselves. We thought we could just go and be the weatherization experts on top of everything else we do, but don't do that. That didn't work for us, at least. We started to utilize our partnerships and our subject matter experts around us, and that helped us go much farther and be much more successful than we would have been if we just kept trying it ourselves. And finally, we just want to share that we know that there's a lot of resources in our community. There's so much out there, and significant gaps and barriers still remain because every person has a unique situation and has unique needs. They have their own barriers in their life. And so not only addressing each home's unique needs, but each family's individual needs or each participant's needs, and being as flexible as you can in your approach to things has been really important. And I think that's all we have.
Thanks, Emily. Thank you so much, Heidi. So next slide. So next, I want to welcome Richard Vasey, principal and co-founder of Energy Futures Group. He has more than 35 years of experience in the clean energy industry, working with hundreds of clients and programs throughout the United States and Canada. So Richard, I will pass it on to you.
Great. Thanks. Can you hear me okay?
Yes.
Yeah, some really great programs out there, and happy to see such really good progress in the space of weatherization barriers and addressing the health and safety issues in homes, with the ultimate goal of not only taking care of those for the occupants, but also paving the way for homes to participate in the energy efficiency programs. So I'm going to be spotlighting yet another one of these programs. This one is Connecticut's Residential Energy Preparation Services Program, or REPS. So, and just to sort of set a little context in Connecticut, I'm the residential consultant to the Energy Efficiency Board there that oversees the programs in Connecticut. They're they're about $250 million a year energy efficiency programs. That includes residential and commercial. On the residential side, that we treat about 30,000 homes a year that go through the Home Energy Solutions program. About half of those, 15,000 or so, are income eligible, and the other half are market rate programs. So Connecticut's been in residents' homes for decades now, and there was a recognition that that weatherization barriers were really a challenge for a significant portion of customers. And it was interesting to see the poll earlier about how many homes people thought in their programs were barriered from participating in these programs. Really in line with what we've seen in Connecticut. But so we spent a number of years gathering the data, which I just want to reiterate I'll make that statement, but reiterate again, it's really important to have the data to make good decisions based on. So we gathered the data, found what the challenges were, and Connecticut launched a $12 million program in May of 2023, the REPS program, Residential Energy Services, or Residential Energy Preparation Services program, to address, fill a gap that really hadn't been addressed there, and it sounds like in a number of other communities as well too. So I'm going to be just going through. I followed my directions. I have 2 slides. Sorry, there's a lot of information on them, but I'll walk through them. And if people want more information during the breakout sessions later, I can go into more detail as well too. So why don't we go to the first slide? And I just want to say that the Connecticut, I'm really here representing. If you can move the next slide, that'd be helpful. I'm here reporting on what's going on in Connecticut. I can't take credit for all of the good work that's been done there, but have participated in the role as the consultant to the Energy Efficiency Board. Are we able to advance the slide? There we go. Thank you. So there's really sort of two slides combined here. So there's a lot of information, and I'll spend just a minute sort of orienting people to them. I just want to say that the programs in Connecticut are operated under the Energize CT brand. They're 2 primary utilities: EverSource, which has an electric and a gas utility, and then Avangrid that has United Illuminating Electric, and then 2 gas utilities as well too. So there are five utilities in Connecticut, all operating underneath the Energize CT brand. They have an energy efficiency board that works with them, oversees the programs, and works very closely with the state's Department of Energy and Environmental Protection, or DEEP, the state energy agency and regulator. And really, this has been a combined effort to pull the data together over the course of years and then put in place a program. So in terms of the data, the pie chart on the left shows over 4 years, from 2014 to 2018, the utilities had gathered all the data for every home that was barriered, that couldn't participate in their Home Energy Solutions Income Eligible, or HESIE program. And so we had, while there had been anecdotal information previously, it was really hard to make a case and justify spending what ended up being a $12 million program without a lot of good data. And so, a lot of credit goes out to collecting this and learning about what's out there, so we could design a program around it. And as you can see from the data, over the course of those 4 years, there are about 24,000 income eligible homes that enrolled in the program, but about 5,500 of those were barriered. 23%, which is sort of right in the middle of that I think that the polling report showed that, or response showed somewhere between 20 and 30%. We're actually anecdotally, these numbers seem to be increasing from a couple years ago. As we've treated homes, we're finding there are more and more homes that we can't get into, and the ones that haven't participated in the programs are now coming up. So, but generally, especially for the income eligible homes, 20 to 30% seems to be about what we're seeing. The market rate homes are in better shape, and so the barriers in those are something like half of what we're seeing in the income eligible homes. But with a focus on income eligible, this has really been the target market for the Connecticut programs there, and we're seeing about half of the barriers we see are asbestos-like material. That could be pipe insulation, it could be wall insulation. We sort of break out vermiculite, which I think has asbestos in it as well separately, but just so that we have more clarification. But you can see about 45% asbestos-like material, about 6% carbon monoxide issues, which is a barrier backdrafting from incomplete combustion or venting issues, followed by failed combustion area zone as well too, sort of related to that, but poor indoor air quality, spillage as well too from those appliances, gas leak, 17% mold, 6% vermiculite. So these are some of the highest issues that are flagged, and as soon as one of these comes up in the site assessment, that home cannot participate in the Home Energy Solutions weatherization program. So the utilities at that back in the 2019, 2018, 2019, received some funding and did a pilot test of 50 homes, and the results on the right show, of course, these numbers are old and they'd be higher today, but just to give a sense of what some of the actual costs were for remediating these 50 homes in the pilot that came out of this data. Where we're seeing about $15,000 for remediating asbestos, $20,000 for vermiculite, $24,000 for mold, and then you start combining. We have quite a few homes that have a number of these programs, a number of these barriers combined together as well. So jobs that had both asbestos and mold together cost about $35,000. Asbestos and pets, 23, vermiculite and mold, 15,000, asbestos, mold, and pests, $40,000. So, these as we're probably mostly well aware of, these can be expensive jobs, and so that becomes one of the real challenges is where do we find the money for this, and how do we make this work for customers? So these results come from, as the source in the bottom of the slide here, a Home Performance Coalition conference that Tammy Wilson from Eversource presented at in 2019. There's some good information as well too on the program that came out of this. We can jump to the next slide. So with this evidence, and we ran a number of deep sponsored a number of workshops that really had some great participation. We had 50, 60, 80 people show up at these, stakeholders, contractors, advocates, the utility folks, and really worked collaboratively in Connecticut over the course of the early 20s. Sort of coming out of, I think there's an increased awareness too, coming out of the pandemic, that we needed to address this and put together Connecticut's Residential Energy Preparation Services, or REPS program. The Department of Energy Environmental Protection, DEEP, is the sponsor of this, and they were able to work with the governor to secure some funding from ARPA. And some other resources as well too. We spent a lot of time working with the LIHEAP program, the Low Income heating assistance program, which can which has the ability to allocate up to 15% of the state's allocation to barriers towards these sort of initiatives, and not just pay for fuel costs, but actually put the money into programs that could help take care of the barriers. So with the federal funding and with some state funding and with LIHEAP, in May of 2023, REPS was launched in Connecticut. So it really was focused on the income eligible population, not only the Utility Home Energy Solutions program, but also the DOE Low Income Weatherization Assistance Program too. So anybody who was eligible, who were enrolled for either of those energy programs, found a barrier, they would need to be less than 60% of state median income. They are now currently eligible for up to $31,400 if they are eligible for LIHEAP, or for those who don't meet those thresholds, up to $16,400 for other remediation. So there are caps for each project, but then there also are targets for program implementation. I think we're in the process of considering readjusting this, because this makes it challenging for ICAS, which is the contracted program implementer for this REPS program. It's hard to manage individual program caps and also maintain an overall program average, which is what the last bullet on the left-hand slide is. So the program has historically had to focus on meeting average costs of $14,000 for LIHEAP customers or $6,400 for others. That is currently under discussion. We'll see where that goes. But we have a pretty comprehensive offering that really covers a long list of barriers. Those are listed here on the right: asbestos or asbestos-like material, vermiculite, mold, moisture control, lack of ventilation for indoor air quality, knob and tube wiring, roof repairs, not full roof replacement, but repairs to make sure we're not leaking moisture, adding to the moisture load of the house, smoke carbon monoxide detectors, some minor grading to correct drainage issues, gutters, downspouts, sump pump. With this past summer especially, we're seeing an increased number of moisture-related mold issues in our housing stock there. Now we're under a drought, but this summer it was particularly wet and did see a lot of those issues. Pests, radon, air exchange issues, and as you saw in the previous pie chart, combustion area, combustion zone, leakage, ventilation, issues around HVAC equipment as well too. So fuel leaks, CAS testing that doesn't pass. So we have a contractor in ICAS that really has done a lot of work sort of standing up a program from scratch, have a system now. I've got a lot more details that we can go into in the breakout sessions at the end if people are interested in more around this. But this is really a sort of a high level. We've had this program out on the street for a year and a half. There are challenges, in having people come into the program, remediate them, put them back, and get them through the energy efficiency work, the SIE and the WAP program. But it's successful. We've now treated hundreds of projects, and we're well on our way in Connecticut. So maybe with that, I'm happy to wrap it up and spend additional time in the breakout sessions later.
Thank you so much, Richard. So we're actually going to do the Q&A after the second panel presents, just because I want to be mindful of time. So if you have questions for Bert, Heidi, Emily, or Richard, please add them to the chat and we will get to them later in the agenda. So you can go on to the next slide. Before we transition into the second panel, we have another poll question. Weatherization can have which of the following health benefits for building occupants. I don't think this is the correct poll. Can we cancel this poll and do the correct one? There we go. All right, weatherization can have which of the following health benefits for building occupants? Fewer asthma-related hospitalizations, fewer incidents of heat or cold stress, improved sleep, reduction in home fires, or all of the above. And we have 98% voting all of the above. Great. Next slide. Next slide. We have 3 speakers who are going to discuss innovations and opportunities unlocked by integrating health, safety, and energy upgrades. I first want to introduce Wynn Tucker. Wynn is the Director of Policy and Innovation at GHHI. He engages in research, technical assistance, program management, and policy advocacy at the intersection of health, housing, and energy. Wynn, I'll pass it on to you.
Thanks so much, Stephanie. And hello, everyone. So like Stephanie said, my name is Wynn Tucker, Director of Policy Innovation. That poll question just now is just to make sure everyone's paying attention. I think we got a really good response on it. But what we're about to go into the next section focused on innovations and opportunities of integrating health, safety, and energy is looking at those kind of comprehensive health benefits that come from both energy and health and safety upgrades in the home, and looking at some specific examples of how do you measure, quantify, value those benefits, and in particular, thinking about some partnerships with organizations in the health sector. So like health plans, hospital systems, provider networks. There's lots of opportunities in different ways to engage kind of with the health sector and to integrate health, safety, and energy. So we'll go through some examples of that to hopefully seed some ideas for you all. I'd love to invite folks in the chat as well. We're going to present a couple examples here today, but if you're aware of any examples, either your program or other programs of interesting partnerships between, an energy upgrade in the home and a health organization, we're going to go through, how referrals can be provided, how funding could be provided, other partnerships. But I would love to know in the chat if there's any examples of programs that are of interest or, kind of meet that criteria, and we can talk about that all more later. So we can go to the next slide. This is like an overview of kind of non-energy benefits. I think given where we are in the workshop, I want to spend most of the time focused on the actual case studies and the actual program examples. So I'll just make a quick stop here, but this is just a graphic visualizing, when you start with the comprehensive housing intervention, like we've been talking about, integrating energy efficiency, weatherization, health and safety. Just want to visualize that, there's direct outputs from that in terms of reduced energy use, improved air quality, fixing, fire safety hazards in the home, improving thermal comfort, and many other impacts directly from the housing intervention. And that translates into all sorts of non-energy benefits, way more than we can cover here today. But in particular today, we're talking about occupant health. And so as Ruth Ann was talking about at the beginning of the call, there's a really strong research base linking these home upgrades with occupant health outcomes, whether it's thermal stress, and there's all sorts of research on how both episodes of increased cold or increased heat are linked to higher rates of cardiovascular, hospital admissions, emergency room visits, for example, or mortality related to those. So how we can make energy efficiency and weatherization upgrades that then translate into benefits for the population is really, really critical. And so, like I said, I want to kind of talk about how do you kind of measure and value these types of metrics. So I'm going to give one example. If we go to the next slide, a really cool example that GHHI has worked on This is a Healthy Homes technical study that, as you can see by the logos here, is a broad kind of consortium of partners. But this was a study of nearly 300 homes in the Baltimore City with all the homes had a child who'd been diagnosed with asthma between ages of 2 and 14 living in the home. And what the study was doing was measuring when you offer kind of asthma services to this population, what are the health impacts and the health outcomes. And so if we go to the next slide, there's two different types of kind of data collection that we did for this that might be relevant for folks in this audience. So if we could go to the next slide, that'd be great. The first is a survey. And so this was self-reported data through a survey taken 6 months after the intervention. And in that survey, we were asking those who receive services about these types of, you can see in the leftmost column, these types of metrics. So things like, again, this is all having to do with asthma, but hospitalizations, ER visits, physician visits. And then as Ruth Ann highlighted earlier, asthma can be a big driver of missing school and of missing work. And so what we saw from this survey after providing comprehensive asthma services to this population were very significant reductions, over 50% reductions of hospitalizations in ER visits is life-changing for these families. And as I'll get into it in this section, it's also really valuable for our society and valuable for health stakeholders. And so it can be a kind of a starting point for forming some of these partnerships. If we go to the next slide, another way to kind of measure and quantify these health outcomes is actually looking at the Medicaid claims data. And so this was a partnership between GHHI, for this study and the Hilltop Institute, looking at the actual claims data from members who were enrolled in the program. They also looked at similar members who had not been enrolled in the program as a control group, and we're looking at the change in the total cost of care, i.e. the savings, against the program costs. And what I want to highlight, if we go down to the very bottom row, you can kind of see the difference between the control and the treatment, $181,000 of savings, and the program costs were $650,000. This was taken 12 months, a snapshot taken 12 months after the interventions were performed. And these types of asthma services, they have lasting impacts and lasting benefits. And so, you can see these benefits for years down the line after the intervention. And so really within a matter of years, an comprehensive asthma intervention, which my colleague Celicia will talk about kind of what goes into that in a little bit, but that can have a positive return on investment. And so again, first and foremost, we're thinking of the main opportunity with integrating health, safety, and energy is the benefit to the occupant. But as we think about doing that, it really could be interesting to other stakeholders in the health sector. And so that'll tee me up for a quick case study I'll go into. So we'll go to the next slide. Great. So I'm going to tell you about the New York Healthy Homes Collaborative. This is a really unique program, a first of its kind program that GHHI and the other partners you can see here, designed based in New York City. What's so unique about this program is it's a pay for success program. And I'll talk more about what that means, but essentially our health plan partner, which is Affinity by Molina, is paying back investors in this program based on its savings. So that's really, really exciting. If we can go to the next slide. And actually, since we're a little bit behind schedule, I know we've covered a lot about the impacts of asthma. Everywhere we look in the US, you see these disparities in the kind of the costs incurred by asthma. So I'll skip ahead one more slide. So briefly, the context, this program took some years to develop, and the context has actually changed a little bit, and I want to make sure folks know about some of the changes. But the main thing I was trying to solve for is how do you get sustainable funding for asthma services? And again, this type of pay for success model can be really interesting because the health plan who is participating in the program doesn't need to put any money up front. That money could come from outside investors, and then they pay back based on the savings. But it's a really kind of a exciting model that can work for all stakeholders. Now, actually, I'll make a quick note that New York adopted a new kind of waiver for its Medicaid that starting in the next few years is going to actually cover home visiting services for asthma. So that was a really exciting development. And it's kind of programs and pilots like this that are hopefully like leading the way and building the evidence base for more states to do that. So if we go to the next slide, this is just to kind of go through the partners in this New York Healthy Homes Collaborative. I've already mentioned Affinity by Molina. Shout out to the Association for Energy Affordability, AEA. Amy will be speaking a little bit on this panel. And I'll just, again, I've talked about this as a pay for success program. So you have two investors, Northern Trust, and then GHHI was also an investor. They are putting the funds up front. Affinity by Molina refers patients to, and actually we can go to the next slide. I think there's a good overview of how the program works. Affinity by Molina is referring patients to Air NYC, which is a home visiting service provider. And depending on their need, on the patient's needs, they might refer them to AEA for a home modification. And meanwhile, GHHI is working with Affinity to track the outcomes for patients in this program, to track the savings, and that's the model. So we can go to the next slide. I'm going to keep this moving kind of quick because Celicia, again, is more of an expert here, but the model here is really following the national guidelines of asthma and environmental trigger remediation. And we can skip ahead to one more slide, actually. So like I said, this type of a model, this pay for success program, is a win-win for everyone, most of all the beneficiaries, the residents who are receiving services, but also the health plan and providers. It's a way to kind of test out these interventions while limiting the risk, and most importantly, improving the health outcomes for their members. We can go to one more slide, and then I'll pass off Celicia in just a second. So the ingredients to replicate the New York Healthy Homes Collaborative, and I'll be excited in the Q&A and breakout rooms if folks have more questions to talk about that. I should have maybe mentioned earlier, we're in the midst of operating of service delivery for the New York Healthy Homes Collaborative. It's a 4-year period of service delivery and then a 10-year evaluation period encompassing those 4 years as well. But kind of the key steps we see here are to identify specific subpopulation in need of services, identify a model and provider of those services, and then really the evidence base. I think this data and evidence-based piece has come up in a lot of the speakers today is really key. And finding the strongest evidence you can. Again, the Medicaid, in this case, we also did a similar Medicaid claims data analysis of members of Affinity by Molina to get to really show in a rigorous and quantitative way that there would be savings from this program. A lot of this can vary state by state is the last thing I'll say. The health policy and the Medicaid waivers in each state is different, but especially if you're in a state where there is some sort of Medicaid pathways for funding home repairs. Amy in a little bit is going to talk about an example in California where that's the case, and there's more and more states are kind of adopting these types of programs in their waivers. So just something to pay attention to and something happy to talk about more. So with that, I will pass it to Celicia.
So now I'm going to introduce Celicia Rosden-Smith. Celicia is a director of family advocacy services at GHHI. She manages GHHI's client environmental health education, national and local trainings, and its asthma program. Thank you so much, Celicia.
Thank you, everybody. Thank you for having me. Today, I'll talk a little bit about our overall asthma program services and a case study at GHHI. Next slide, please. All right, so this is a little slide talking about our health partnership service model. So we have multiple different partnerships, and generally they all will kind of have the same service model. So at first, it will usually start with the warm handoff. What that means is that is a warm handoff between the provider and the client, so they'll know exactly what will reach out to them through GHHI. After that, we'll receive a member list specifically, and that will come on a regular basis depending on the partnership. It could be monthly, bi-weekly, or whatnot. And our data team will prep that list specifically to enter it into our computer database so our outreach services can commence. And how that happens is our intake specialists and our environmental health educators will outreach to these referral members. They'll give them an intro to the asthma program, as well as schedule that initial visit and obtain any other needs, depending, such as different housing conditions, any missing demographics, and things like that, in order for us to provide the appropriate services for that client. After that outreach and that intro, we will begin the initial home visiting for the asthma program services. So within that initial home visit, there's a lot of information that is provided, such as we'll ensure that they are up to date with the program overview, the follow-up structure, which generally is a 3, 6, and 12-month structure, education, as well as control and severity surveys. We also provide an environmental health assessment on the home for asthma triggers. We'll discuss what interventions are going to come out of it, as well as the scope of work from the environmental assessor. We'll distribute all the materials and educational materials, and then continue to reiterate the process with the education and the services. After that, we'll discuss what interventions are going to happen based on the scope of work that that environmental assessor provided. And then, of course, again, the follow-up structure will begin. Next slide, please. So there's a few partners that we work with. Here is definitely not a limited list, but I'm sure we'll all get the slides so you guys can also read a lot of this later. But just to name a few, definitely strong partners. We have HUBS, Housing Upgrade Benefit for Seniors, as well as the Community Development Block Grant, or CDBG, as well as ARPA, the American Rescue Plan Act. Next slide, please. All right, so this slide shows a little bit about a robust partnership that we have with the Maryland Department of Health and the Regional Partnership Catalyst Grant, which is a grant and service program that we have been providing for the last few years. There is a statewide initiative called the Statewide Integrated Health Improvement Strategy Goal, in which we're focusing on trying to decrease the asthma-related emergency department visit rates for all children up to 17 years old. There was a baseline rate in the year 2018 of 9.2 ED visits per year per 1,000 individuals. And our target for up until the year 2023 in year 5 was to achieve that baseline, to go from 9.2 to 7.2. And then when the grant is finishing out, the target is to go from, again, 9.2 to 5.3. And we are on target in our goal for that right now. So that's the overall goal that we are striving for in having this partnership. And our specific goals, again, were to ensure that we're treating asthma in the home, reducing triggers, making sure to reduce missed school days and missed work days for parents as well. Next slide, please. So this slide will show you a little bit more in our partnership with the Regional Partnership Catalyst Grant, as well as the Maryland Department of Health. So basically, with this grant, over the lifetime, in our about 3.5 years, we're treating 280 children in Baltimore City, as well as 210 children in Prince George's County. So some of the services I kind of stated before, with the home visiting, they'll get 3 set home visits, along with a few follow-ups from the environmental health educator, along with the education for proper inhaler usage and how to improve their behaviors, basically by reducing triggers in the home. The environmental assessment, of course, providing different supplies such as a HEPA filtered vacuum cleaner, allergen-proof mattress and pillowcases, as well as multiple other cleaning items. They'll receive integrated pest management as well, to reduce pests and rodents in the home. And then that is specifically for Tier 1 services, and a number of children and families as well are able to receive Tier 2 services, which are all the Tier 1 services plus specific other trigger reductions, such as mold remediation, more integrated pest management, carpet removal, venting of dryers, bathrooms, and kitchens, and a lot more. Next slide, please. And this slide will kind of just show you how our operation works, how we integrate health and energy service together with our well-rounded team in order to achieve these services. So of course, we have an intake specialist that will be the first contact for the client. We'll have the environmental health educator that follows that client from visit 1 all the way to the 12-month closeout, ensuring that they are well taken care of. Our environmental assessor will conduct the assessments in the home and ensure that all the services that we say we're going to provide are provided. We have a data and evaluation manager who will oversee the data collection and will oversee the analysis and evaluation of our outcomes. Our housing intervention coordinator will make sure that all of the service work is completed as needed. If we need a subcontractor, we'll obtain those proper estimates. Our housing reduction workers will conduct those tier 2 intervention, and then our housing rehab director will oversee that entire scope of the housing reduction team. Next slide, please. And this slide in general, you guys can definitely read it a bit more thoroughly later. Here's an example of a case study that we had provided. During COVID, we were able to provide the same services that we did during a non-COVID period, which was an amazing. There were a lot of worries from clients, of course, allowing people in their home during this time, but also their children still had asthma issues. So one of the big outcomes where we were able to still provide our asthma services. With this case, our family, they had a lot of asthma triggers going on and schools were closed. Mom was very concerned about the exposure to triggers as well as exposure to the actual virus, but we were able to go in there, obviously with protective equipment as well, supply everything that we normally would with our asthma supplies, our education, our tier 1 and tier 2 interventions, and we were able to follow up with each visit, ensure that the mother was acclimated with her care management plan, as well as ensure that asthma was controlled and severity was decreased. Next slide. And that is it. Thank you, everybody, for your time.
Thank you so much, Celicia. So next we have Amy Dryden, excuse me, who is the Director of Strategic Innovations at the Association for Energy Affordability. She specializes in strategic initiatives, codes and standards, program design, training, and research projects focused on decarbonization, indoor and air quality, and health. Thanks, Amy.
Great. Thank you so much for having me today. Hi, folks. Mentioned Amy Dryden with AEA. I'm going to talk about some work we've been doing. Just a quick intro. AEA, as you heard from when it's also in New York. We started there 30 plus years ago as a training organization, really supporting weatherization. I'm in our West Coast office that was established in 2010. And really, we do a lot of program implementation here in California, upwards over 18, all dealing with electrification in some way, mostly multifamily, some single family, mostly affordable, some market rate is our kind of realm. And to move this industry forward and to have more sustainable, affordable, and safe housing, we deal with training. We work in the training sector to build capacity. We push up policy or look at codes and standards, leveraging our learnings on the ground of what needs to change. And we do a lot of research and pilots to kind of test processes, products, approaches out to see what's working and what's not, and bring what's working kind of like into our new business as usual. So I'm going to talk about one of the pilots today. Next slide, please. So within this, I'm going to just talk about the project goals quickly. I'm going to skip a lot of the why because it's been covered, but there's one graphic I just like to have, the program model and recommendations and considerations. I didn't include any data in this. We can dig into more, in the breakout sessions, or folks can follow up. But just giving you kind of like a quick snapshot in this time frame. So next slide, please. So what I'm going to focus on is this kind of pilot in Contra Costa County. So you can see there is California in the right-hand corner, and you can see San Francisco. So we're across the bay in a county. And I'm going to talk about kind of two phases to this. Most of the information is going to be focused on this first phase, where the program goal is to provide comprehensive services to communities impacted by environmental equities. Coupled with that, we have a research goal of documenting changes in indoor environmental quality that results from our energy efficiency, our asthma trigger mitigation, and our electrification retrofits. And we had a policy goal is like, how can we expand this program with more sustained, durable funding? You've heard a lot about funding today. And when I mentioned this previously, recently in California, we had the approval for community benefit organizations to include asthma home services and some mitigation measures in there in lieu of. So it's $7,500 for a lifetime expenditure per individual. And so that's been utilized some for consumer goods and some for some ventilation measures through some programs and some for just asthma home visit services. This initial funding was funded by a number of different grants, and we tried to couple it with traditional energy efficiency and electrification programs, and I'll show you why in a couple of slides. Next slide, please. This project and this pilot is kind of two-phase. So the first phase was done 2021 to 2023, severely impacted by kind of COVID and access to that. Through that initial pilot, we did 15 retrofits. Our goal was 38. We provided deep cleaning to a number of folks, and we did 9 homes that we actually did monitoring, and our goal was 10 to 12. We could not serve. There was like 62% of participants we could not serve due to lack of access to the home from landlord permission. So that's something we can talk about another time. The phase 2, which we're in right now, we're targeting 50 homes in 2 years in 2 counties. So Contra Costa, I told you, and then another county just below it in Alameda, still in the same general area of California. And we're doing at least 21 homes monitoring. We're also surveying 300 or plus multifamily units. Next slide. These are the questions we're just trying to answer here, like what works well with the model. So, you know, a lot of us are kind of exploring that. How do we bring kind of like health that can be in a parallel track to energy efficiency and electrification? How do we bring those together? What's working well? How do we engage the residents? What can we do in each home? What improvements did we see? Both from changes in indoor air quality concentrations of like particulate matter, NO2, and or health of the asthma residents. And what improvements can we expect to see? Next slide. This is the my quick slide on a little bit of a why. I am not a health professional, like an anthropologist, building professional, constructional professional, et cetera. But this was introduced to me by our Bay Area Regional Health Inequities Initiative, where really showing the impacts of social determinants of health, and where kind of health side is usually used to working on risk behaviors and injury, et cetera, right on the right side of this diagram. But we're really focusing on the left side as we bring these things together to address conditions that are affecting folks' health, right? Class, race, institutional equities, living conditions, like all of these are kind of emerging in the public health practice. Next slide. And this I just wanted to show off. This is Contra Costa County. 300,000 residents live in a census tract that is in the 95th percentile or higher of asthma emergency department rates statewide. It's like, which is the largest number in the county and the state. This county also has railroads, major freeways, and 5 refineries. And you can kind of see where they are if you're looking at the asthma rate. So this is why this pilot was initially championed by the ombudsman in the Contra Costa County Health Department. Next slide. Great, only have a couple minutes. This is our model. Just really quickly wanted to show you that we were coordinating with community health workers who are doing the outreach to asthma patients. All homes were low income. All homes had an asthma, somebody with severe asthma in it, whether adult or child. They gave them consumer goods, health education, and then if they consented, they referred them over to us. And not sure. To do a home assessment and make recommendations for asthma remediation measures, energy efficiency measures, and electrification measures. On either side of that retrofit, if we could do it, we were doing monitoring for 2 weeks. Then we did the retrofit, then we monitored for 2 weeks. We also did surveys similar to what we've seen other folks do to get some data to understand the benefits. Next slide. So here's kind of what we think about reducing asthma triggers for the, for the measures there and the asthma trigger on the left. But if you go to the next slide, these are the ones that aren't covered by kind of more traditional energy efficiency measures. And so where we're bringing a lot of those dollars to bear from other sources. And the one thing I should make sure is highlighted here is, combustion appliances. We still can't do some of that through our traditional energy efficiency weatherization practices. Next slide. This is just a screenshot just to see the diversity of houses from single family to multifamily, 1 story to 2 story. Next slide. And the thing I want to leave you with is just the recommendations. Like you can see the list on the left-hand side. I'm not going to go through them all, but how do we engage landlords to make this happen? What about participants? How do we engage them to say yes? And what information can we share with them? How can we streamline this program model? We definitely need robust educational materials. We really want to expand measure eligibility so we can really deliver these benefits. We have seen great benefits from reduced medication use, reduced ER visits. And so because of those benefits we've seen and others have talked about today, we really want to look at how do we scale this work and bring this work into more programs so these benefits can be realized in these underserved communities. So I know that was pretty fast to kind of keep us on target. So I'll be happy to discuss more, share data in a breakout room. So thank you very much for your time today.
Thank you so much, Amy, and thank you so much, panelists. Now we're going to move on to a quick Q&A, and if we don't get to your questions, you will have the opportunity to speak directly with the panelists in the breakout rooms. So yeah, we'll be able to get to the questions then. So the first question that I have is for Bert, I think, or anyone else who can answer this question. Is ventilation equipment also upgraded in conjunction with energy efficiency and weatherization work? If so, what are the ventilation considerations, especially for homes in cold climates?
Yeah, we will typically assess ventilation needs when we'll go in to conduct our health and safety audit, and at that time we'll install primarily in kitchens and or bathrooms proper ventilation measures to ensure that we're keeping the mold down. I know the question, I think when I saw it came in, asked about sort of more sophisticated ventilation strategies to turn over air in the buildings. And in the housing stock that we're working in, which is generally older, New England type housing stock. A lot of these places are, 100 years older or more, not uncommonly. We have not looked at what is HRVs and ERVs specifically. So I wanted to answer that question as well.
I think if I can just add on one thing, I think one of the challenges sometimes is if we're adding ventilation, right? Whether it's in bathroom or range hood, it's not seen as an energy efficiency measure, right? Because you're adding load. And so in not in all cases, but in a number of programs, that's not allowable because we're adding load. LIHEAP rules are different from state to state. And so ventilation is not something we can include in ours. So when we've been working through these programs and figuring out how to deliver these services, it's been something we've covered with outside sources to be able to do it. It's something that's part of the assessment, but it's navigating what's allowable through different funding sources.
Mm-hmm. And it frequently falls into that sort of gap. You've got to go looking for
right.
it. Yeah.
Yep.
Thanks. So my next question is for Fort Collins, or City of Fort Collins. What type of staff capacity is needed for the community engagement you have done? And also, how are you able to coordinate across programs and agencies? As we know, this can be very challenging in many situations.
That's a great question. The answer is we could always use more, right? But we were able to, through those grant opportunities, we were able to hire some contract positions to add to the team. But the team currently consists of 2 full-time roles and 1 part-time role. And then, like we mentioned, a lot of volunteers. So that's how I think we're able to keep our program going and sustainable, is that our volunteers, having that team of volunteers that conduct a lot of the assessments allows us to have the time to focus on running all the other pieces of the program, and staff do assessments as well. But having a strong volunteer pool has been really essential as far as doing not only the in-home assessments, but also in providing that authentic community engagement. Because if I go to ask a community member who speaks different language than me, maybe, or doesn't look like me, and I have my government logo on, if I go to speak to them and try to get authentic, feedback about what their needs are and what our program can do for them, I might get a different answer than somebody who is actually just their neighbor down the street, right? And so really utilizing our community members and having a trusted relationship with community members in the volunteer sense has been really essential. And I will say too, looking at compensation is a big piece too. So when we've had focus groups that helped us with designing our program, looking at how we can compensate folks for their time has been really important. And with our volunteers, they are volunteers, but we look at different ways that we can provide gratitude to them. So sometimes that might be, we have quarterly gift cards that we provide that, or other like gifts and incentives that we provide our volunteers. I think I'm veering off of what the original question was, but that's I would say volunteers is how we make it work when we have a pretty, only 2.5 positions really doing all of this work, and the program is expanding. So we are looking at continuing to bring on more staff members and expand the team in the future.
Great, thank you. I'm going to ask one last question before we go into our break. And this question is for Amy, but others feel free to chime in. When working with renters, was landlord turning the program down or not having a response a bigger issue?
So it was probably about 50-50 of like, out of that 62%, like half of it was unresponsive, and half declined. And so getting a hold of folks through multiple methods was a challenge, and then getting them to a yes was also equally a challenge. And we're looking at different strategies to engage with landlords really outside of programs to maybe have a more open conversation and engagement and education, where we're not in a position of trying to get them to say yes to something for a specific building, just to build more capacity and more relationships, but 50-50.
Great, thank you. Would anyone else like to chime in? Okay, so that is it for the Q&A portion. Again, we couldn't get to all of your questions, but you will have the opportunity to ask questions directly to the panelists when we get to the breakout rooms. Okay, so everyone's coming back from the breakout rooms. I hope that you made some good connections with our experts and your fellow workshop attendees. We now have another poll based on today's presentation. What health and safety related goal are you most excited about pursuing for your own program? So communicating the health benefits of home upgrades to your community. So you can see the results here. Great. Now going on to the next slide. So we are wrapping this topic up, and sorry, seems like the poll is showing back up. So we wanted to wrap up, and I hope that you enjoyed this workshop. If you didn't have the opportunity to attend prior workshops this year, you can have access to the recordings and the materials via the EPA Energy Star website. And even though this is our final workshop for 2024, we encourage that you stay connected for more information about workshops in the upcoming year. And lastly, if you go to the next slide, I just want to say thank you so much for attending today's workshop, asking such great questions, and participating in the breakout sessions. You will be directed to a survey to provide feedback regarding this workshop and share your ideas for future workshops. Have a great day, and I hope to see you at future workshops.